Hi, welcome to Basics with Baby. I'm Trisha.
Hi, I'm Anna.
In this video, we just wanted to share with you some things prenatally that may help you in the first day or two of your baby's life with breastfeeding. Um, we teach our patients in the hospital in the first few days to recline back and let the baby lay on top of you to begin showing cues and looking for the breast and the nipple. This might be something you didn't realize. They're all the pictures of moms breastfeeding. There's lots of them. They're sitting upright in a chair and babies sort of cradled in their arms like this. And when I go in to help a mom, that's kind of the first thing she wants to do is sit upright in the bed or in the chair beside her bed and hold the baby in a cradle position. And really, new babies, their whole body is supported on you when you lean back and recline and have them laying on top of you. And one of the very first things I do is I tell a mom, okay, I'm going to recline you back. And many times they're looking at me like, are you crazy? And I will do, like, maybe not all the way recline back at first, because moms are, like, what's going on? How are they going to be able to nurse, recline back like this? So I may gently recline them, but we're just putting it out there too, that reclining is a great way in the first couple days to learn, and your baby to learn to breastfeed with you.
And the reason that helps is because, like when the baby's first delivered and they lay the baby on your chest, hopefully you're fully skin to skin. That means nothing in between you and the baby. And babies learn by touch, feel, smell. Their instincts come out, crawling to the breast. And so a lot of times you have good success after delivery, hopefully. But even if baby doesn't latch on just right away on that initial golden hour time, every time you put the baby back to the breast in the hospital, we would suggest reclining back, fully skin to skin, letting the baby kind of do a little bit of that breast crawl. Let the baby open wide and look and turn their head. That's going to help them open wider and get that tongue extending and use all their instincts to help them get a good latching established in the beginning.
Also, watching your baby. Your baby's actually talking to you in many other ways other than just crying. And so I'll tell a parent, watch as we do this. Watch as the baby is latched on, and when they nurse, I'll say, watch their hand open. As their hand opens and their arm relaxes, they are becoming full and getting, satisfied with the colostrum they're getting. And so that baby's given us those cues. So hunger cues, which we talk about a lot of hunger cues, baby hand to mouth, licking, bobbing their head and looking. Lots of people know that. So that's before feeding. But during feeding, babies give you those cues also. Their hands, when they're hungry, hands tied up. But as they nurse, they start to relax, which I will tell moms and dads they're half full. Then when they're all the way relaxed, really stretchy arms, and they're really slowing down their breastfeeding, they're getting full. So that's just kind of another thing to look for, that they're communicating with you more than just crying.
And I just wanted to reinforce on the skin to skin, that is not just for the first golden hour, or even not just for during the hospital time. We know that for the first 2 weeks, moms and babies that do skin to skin, with almost every breastfeeding as you can, you're going to have higher success with breastfeeding long term. So at least for the first 2 weeks, please unswaddle that baby, as well as you can get the arms, chest, hands involved.
Take their clothes off.
They're going to learn better that way and be more alert and active.
Yes. Also, another thing that I want to stress importance to is the nurses are coming around, and you have to realize postpartum nurses are watching, 3, 4. Sometimes if they're just doing babies in the nursery, they may be watching 6 babies at a time. And they want to make sure that all babies are getting the opportunity to eat and breastfeed. So they are going to be telling you to breastfeed your baby about every 2 to 3 hours in the hospital. Lots of times, sometimes if a mom delivers in the afternoon, we may not get to them until the next day, and they're like, it's not going well at all. The baby's only breastfed 4 times, and they're telling the baby won't wake up and is very sleepy. I just want to get the message out there that in the first 24 hours, if the baby nurses 3 or 4 times, we're very happy with that. Babies are sleepy. They've gone through labor and delivery themselves. They are recovering. You can hand express. If you can just hand express a few drops and give that baby some drops, if the baby is too sleepy to latch, the nurses will be happy if you say, the baby got drops this time, and the next time maybe the baby will nurse. But so in the first 24 hours, when they are no longer connected to their constant food source, the placenta and you, and they have reserves that they've built up. So they've recently been disconnected from you. They have reserves. We're happy with 4 feedings in the first 24 hours. You are not already not successful. Okay.
Right.
We want you to know that's great.
That first 24 hours, they are transitioning to life outside the womb. I like to tell parents, nobody told baby yesterday that they had to wake up and eat every 3 hours. They are not robots on a schedule just yet. They, they're tired and recovering, and just, it's really all about their instincts in those first 24 hours. And this is for, that full-term healthy newborn baby. They have extra fat stores at birth. Their tummy size is about the size of a marble or a cherry the first 24 hours. They are not expecting high volumes of milk, and their intestines are full at delivery. So they're really not usually born hungry. They're just born with the instinct to suck, and they're stimulating the breast to tell mom's body, hey, I'm born now. I'm on the outside. Start producing milk for me.
Yes, and lots of times, see, that second day, the amniotic fluid is moving through the baby's system, and they're hungrier on the second day and not as sleepy because they've been through that recovery period. So the second day, we like to see 6 or 7 breastfeedings that day. And, if that isn't happening, we may, let's hand express more. We'll assist you, guide you along the way with that. But again, 8 to 12 breastfeedings on the 3rd day. That's our goal for the rest of your breastfeeding journey. But in those first couple days, every 2.5 to 3 hour, you have that grace period, and the baby has reserves.
So take a deep breath, reduce that anxiety, bond with that baby, and log on to Basics with Baby when you get home and you have questions, and we'll be there to support you.
We'll see you then.
Thanks.